The idea behind our study was to evaluate the possibility of scapular spine autograft for glenoid bone augmentation. As the readership knows, there are downsides with all of the different graft options that we currently have available for shoulder instability with glenoid bone loss, including the Latarjet procedure and then use of autograft from either the iliac crest or distal clavicle, and then also the use of allograft from the distal tibia. So the idea was to see if it would be possible to use the scapular spine as a decent source of autograft. We used CT scans from trauma patients in which we were able to get the CT of the pelvis and the torso so that we could do measurements on the scapular spine, the coracoid, and the iliac crest. And our findings indicated that the size of the scapular spine in most patients was very similar to that of the coracoid. Of course, in the iliac crest, you have a larger bone and potentially more bone to be taken, but the general harvest site and approach for even the iliac crest, the sizes were similar to that of the scapular spine. One other interesting finding, in addition to overall volume of bone graft, was that the superior aspect of the scapular spine, the radius of curvature, was very similar to that of the glenoid, and that may also be an advantage of scapular spine autograft. Based on the results of our study, it seems that it would be reasonable to use scapular spine autograft for glenoid bone augmentation, particularly in small to medium-sized defects. Next steps include biomechanical analysis, of which we are in process of analyzing our results biomechanically. If that proves to be advantageous, then next steps would be clinical application.